Endodontists have a hard time when it comes to student loan debt because not only do they need to go through 4 years of dental school, they then have to go through a 2 or 3 year residency program where sometimes they might even accumulate additional debt. How does this all happen? Well, as you might know, you have to go through 4 years of dental school and take out dental school level student loan debt. Our typical dentist has got debt averaging about $370,000. Of course, that ranges a lot from maybe $200,000 for an in-state public university to $550,000 or more at a high-cost private school in a big city with really high living expenses. So if you take that kind of a debt and then you have somebody go to residency program, let me tell you what most endodontists do. They defer. They don't make any payments. They let their interest grow and they build no credit towards loan forgiveness during this 2 or 3 years during residency. So during that period, the debt continues to grow. In some cases, even though many endodontists will get a stipend of some sort during residency training, because of fees that they might have to pay, they might take out additional debt during that residency training and have even more student loans overall. The typical amount of debt that we've seen for our endodontist clients really ranges, but it's often over $400,000. How do you deal with that kind of debt when you might come out and you might make really good income? You could make maybe $30,000, $35,000 a month, as some of our endodontist clients do, but then again, you might also only make low 200s or maybe in the worst case, even lower than that if you're living in a big city with lots of supply of endodontists like in Southern California and New York City. So the goal is that you would live the life that you want to. Let me explain. So for example, let's say that you're an endodontist in Texas and you're making tons of money, you don't have a state income tax, your debt to income ratio is maybe about 1.3 to 1, so let's say you have $400,000 of student loan debt and maybe you've got a $300-something thousand income. You know that you want to pay this back, but you're not exactly sure when you should do it. When you come right out of school, what I would suggest is if you know you want to pay your loan debt back, then you want to try to get into a repay program, revised pay as you earn. Preferably you want to get into this right when you're in training. When you're in training doing the revised pay as you earn program, you'll be able to basically get interest subsidies, which is going to lower the effective interest rate on your loans. Deferment is a terrible mistake if you're in an endodontics residency program. We see people make it all the time, and it's usually a low 5-figure mistake to do that. Now, when you come out of residency, you should already have a couple years of credit towards loan forgiveness, but you're not going to need that because you're paying it off. You're going to have a lower loan balance. Now, if you're going to set up your own practice, I would recommend that you wait to refinance until that's already finished. However, if you are just working different offices and you plan that to be your typical path that you're going to have for your career, you don't have an aspiration to set up your own practice, then I would say that get your loan balance down to like 1 times your income and then try to refinance that thing. You want to shop around at least a couple lenders. We have refinancing bonuses that are among the best anywhere you'll find on the internet. So you could shop around, ask us for advice if you need help. My email, by the way, is travis@studentloanplanner.com if you have questions about endodontic student loan debt. Now, that's a good strategy if you have a reasonable debt-to-income ratio. However, what happens if you're in California and you owe $600,000 as an endodontist because you went to Pacific Dental School and you also went to a high-cost residency program with a low stipend? In that case, your debt-to-income ratio, let's say it's 2.5 to 1, is not going to lend itself well to actually paying that debt off. In that case, you'd want to go for something like loan forgiveness. In this particular case, you could use the pay-as-you-earn program, pay for 20 years. You might pay maybe 50% of the actual loan balance over those 20 years in actual dollars. And then at the end of that 20 years, you'd owe taxes on that forgiven balance as if it was income. So in other words, if you had a big forgiven balance, you'd have to pay maybe 40 or 50% income taxes on that forgiven balance. Now that, if you look at the present value of that math, that can be a very attractive strategy if you have endodontic level student loan debt. And the goal here is to minimize the cost. You could work part-time if you want to maximize lifestyle. You can buy a house. We would suggest that you buy a house no more than 2 times your income if you have a big student loan debt from endodontics programs. There's a lot of different things that you can think about. The key is to get a plan. In Student Loan Planner, we're experts in developing those plans for endodontic level student loan debt. Getting a plan does not have to feel like a root canal. You don't have to dread it. You don't have to worry about it like the general public does. We're probably the only group in the country that has advised multiple endodontists about how to figure out their huge student loan debt. So just visit the article, click on the contact button, Reach out to us. We would love to hear your story, love to hear what's on your mind, and we would love to get a plan for you to pay back your endodontist student loans.